The opioid crisis remains a pressing public health challenge that requires extensive community engagement and responsibility to address effectively. As the death toll continues to climb, it becomes increasingly evident that community-driven efforts are crucial for mitigating this complex issue. Localized initiatives empower neighborhoods to create a direct impact, fostering environments where individuals can access the support and resources necessary for recovery. The rise of gas station drugs, synthetic opioids, and other dangerous substances that are easily obtainable from local convenience stores further complicates the landscape, making education and prevention strategies vital components in community response plans. To effectively combat the opioid crisis, communities are unifying around shared goals and implementing comprehensive prevention programs. Educational workshops that inform residents about the dangers of opioid misuse and the risks associated with gas station drugs can lead to greater awareness and early intervention. Furthermore, established local support networks and partnerships with healthcare providers enhance the availability of addiction services, fostering a culture of recovery and resilience. Law enforcement agencies are collaborating with community groups to enforce regulations on illicit distribution points, focusing efforts on preventing the spread of addictive substances. Another critical aspect of community engagement involves removing the stigma associated with addiction and encouraging open dialogues about substance abuse. Community leaders are organizing events and forums that allow individuals affected by the opioid crisis to share experiences, promoting understanding and compassion. These conversations not only humanize the struggle with addiction, but also encourage broader participation in recovery initiatives. Creating a supportive and inclusive community atmosphere increases the chances of successful recovery and addiction prevention. Solving the opioid crisis is not an isolated task, but a shared responsibility requiring active community participation. Through education, prevention, and collective action, communities can play a pivotal role in reducing the prevalence of opioid misuse and the accessibility of gas station drugs. Collaborative, informed, and compassionate engagement are paving the way for healthier drug-free communities, transforming the landscape of the opioid crisis into one of hope and recovery. To learn more about gas station drugs and the drug testing resources available to help detect misuse and aid in treatment efforts, visit 12panelnow.com today.